Well, welcome everyone to this very informative session on growing community supports as alternatives to institutionalization of older adults, which none of us wants. I'm Trish Spindell, Chair of Seniors for Social Action Ontario, and I'll be your moderator today. So it is my pleasure to introduce to you our presenter, Christina Bisanz. Just before I do, I want to remind everyone to please mute your sound so that we're not hearing things we shouldn't. Okay, thank you. Um, by anyone's standards, Christina is a very accomplished woman. She's been elected and re-elected for 3 terms as the councillor for Ward 7 in Newmarket. She also serves as a member of the the Human Services Planning Board of York Region. Her volunteer contributions to her community are significant, too numerous to mention in a short introduction, but they span many years. As the CEO of Community and Home Assistance to Seniors, CHATS, she is committed to helping thousands of older adults continue to live independently by providing support to them and their caregivers. There is no one better to speak to us about growing supports for older adults than Christina, so please welcome her. Thank you, Christina. Over to you.
Thank you so much, Trish, and to all of you for this opportunity. I've listened to many of the SSAO's webinars and find them to just be a wealth of information. So to be invited, included as part of this group of presenters is really such a delight and thrill for me and an honor for me as well. Anyway, today's presentation is a bit of a double entendre, as I'll be speaking about the growing demand for community support services, as well as what we need to be able to grow the sector's ability to meet this demand. It's not news that our population is aging and people are living longer. The thought of living to 142 years may be intimidating for some, but who knows, with advancements in health and well-being, that could become a possibility. So while the good news is that people are living longer, the challenge is that having resources to support a population that is living longer with very different care needs than the younger demographic is something that we need to start thinking about now, or should have been thinking about for some time. It's also no secret that older adults prefer to age at home as a way of maintaining health, independence, and dignity. Many studies, and you're familiar with them, have shown that aging in place is more cost-effective than long-term care. However, the reality is that this can also present difficulties for some seniors depending on the complexity of their care needs. We also know that age, health, wealth, and the presence or support from an informal caregiver can affect the feasibility of staying at home. The difficulty that we're already seeing is that the number of people who are expected to provide care as an informal caregiver has grown significantly, but so too has the burnout amongst that population. If the presence of caregivers is part of the secret sauce for aging at home, we know that they can't do it alone. Caregiver stress and burnout is increasing at significant rates, and as a result, they're turning more and more to home care and community support services as a way to enable them to continue to provide support for their loved ones, but also provide themselves with the kind of care and relief that they need. The dilemma we face is, how do we effectively manage the growing demand to live at home without putting even more pressure on caregivers as well as the available services in the community? We're, as an organization, already seeing our wait lists grow significantly in many of our service areas, and just trying to keep up with the demand is challenging for us. It's challenging for our clients and challenging for their caregivers. But let me tell you about CHATS, Community and Home Assistance to Seniors, and how we fit into the solution, but also what we need to make it happen. We start as an organization from the belief and premise that older adults live best at home and in their communities. One of our strategic priorities is to advocate for person-centered home and community service to provide not just independence, but dignity and choice. We are about a $21 million multicultural organization, and we provide both home care as well as community supports through tailored care plans and what we call our basket of services. So some of our clients may choose to utilize a number of our services, and some may only be a client for one service. It really depends on the care plan that's been developed in concert with the client themselves and identifying the goals that they hope to achieve. We operate with about 300 staff. Most of those are frontline, personal support workers, home care support workers, drivers, recreation therapists, client care supervisors, and some 250 volunteers. We often say, and because CHATS actually had its roots as a volunteer-based organization, that our volunteers are the heart of CHATS, and we truly wouldn't be able to do what we do without them. Our programs and services are many, and I'm not going to go through all of them on this list, but we provide everything from transportation to social programs and medical appointments, kidney dialysis, banking, grocery shopping, Meals on Wheels, which is more than just providing somebody with a convenient, nutritious meal. It's also about providing food security. And with the economy being what it is, that becomes even more and more crucial to a number of our clients on a daily basis. We have adult day programs that offer activity, social engagement, as well as a nutritious meal for our clients. But it's also a respite program where caregivers can bring their loved ones and know that for the day, their person is going to be active, involved, happy, and they have a day to themselves to work, get their hair done, whatever they need, but also to give them that much needed break and relief. We provide assisted living in some 18 different sites, which is 24/7, 365 day care, and both scheduled and unscheduled visits to our clients who are living in a building that we're co-located in, or within the immediate community surrounding that building. We have a number of diversity social programs for newcomers and people who want to be engaged in their own cultural community, but perhaps have otherwise been isolated due to geography or economic status, and many, many more programs that we offer. We also focus on caregiver support by providing them with respite care, education, and support groups. Even though a number of our services do have a moderate fee attached, there are a few that are fully subsidized, mostly by Ontario Health, but our caregiver supports are available to caregivers at no cost at all, with the exception of the respite care, which is essentially providing caregivers with home care support at a rate that's subsidized and lower than private care, should they want that. So this is a slide that shows the breakdown of our client demographics. Currently, we serve about 8,000 clients. We were over 8,500 prior to COVID. Through COVID, we did have some clients who dropped off, and unfortunately some clients who did move into long-term care during that period of time. So we've been actively trying to recoup the clients that we lost for whatever reason, and are making good progress there. We serve older adults, 55 and over, but also people with what we call age-related conditions. For example, multiple sclerosis, Alzheimer's or dementias, Parkinson's disease, things like that. We also provide support to those clients. Over a third of our clients live alone. So that's without a spouse or family members. So the challenge and the need around providing them with social engagement to avoid loneliness and isolation is a very significant area for us and our services. Our catchment area covers two regions, York Region and South Simcoe, and we work with 11 municipalities and 2 municipal governments. Interestingly, the geography that we serve is both very urban, such as in Vaughan, Richmond Hill, and Markham, but we also have some very rural communities that we serve. And that presents some different kinds of dynamics for us to have to deal with. Having a personal support worker being able to see clients in a very dense urban area is a lot easier when they have, shorter distance to go from client to client than serving clients who are spread over a rural area and have perhaps less access to things like primary care and have a further distance to go for transportation. So something to sort of keep in mind as well when we're thinking about the kind of support and challenges that community support agencies have in getting out to their clients. We have about 1.3 million total population throughout the catchment area we serve, with a significant number of those individuals being seniors. Partnership is really key to CHATS and how we operate. We're currently anchor members of 3 Ontario health teams. We work with all 4 hospitals in our catchment and participate in advocacy initiatives with 3 organizations, United Way, the Ontario Community Support Association, the Ontario Nonprofit Network, with OCSA being our key sectoral association. This government was originally elected on a platform to end hallway healthcare, and several public policy directives to restructure the healthcare system to focus more on integrated care in the right settings came out as a result of that. And also, as we know, it led to the creation of the new organization Ontario Health and subsequently to Ontario Health Teams. But there are 2 policy directions within that restructuring that particularly affect the provision of home and community care that came about. The first is the modernization of home care, which originally was designed to provide for more flexible care provision and integration with the Ontario Health Teams for more seamless and coordinated care. Unfortunately, not much has really moved forward in this regard. Although there are 12 accelerated Ontario Health Teams that have been working with Ontario Health at Home, which is formerly the LINs, which was formerly the CCACs, to move in that direction, but it has been slow. The next area that some of you may be familiar with is the Home First Directive. Now, this is not a new approach, and those of us who have been around in this sector for a while now have seen it in various iterations. It was called Aging at Home and different names, but essentially the concept and the focus is on providing the right care in the right place, prioritizing home care, reducing hospital stays, and helping patients live independently and safely at home. And this is really an area where we feel that community supports has a vital role to play. The challenge right now is it still is very much hospital focused in trying to reduce hospital stays. So we haven't quite got to the point of effective collaboration and integration of community support, but we are holding this out as an area of opportunity and one where we really feel that we've got a lot of value to bring. Now, our history as an organization is one of adaptation and growth. And for over 40 years, since CHATS was first formed, we and organizations like ours have responded and adapted to the changing needs of our clients, as well as the ebb and flow of health policy direction, especially when these come with funding and ministerial strategies such as aging at home and hopefully to come with home first. Our innovation process, well, we work with our board and leadership team to develop strategic priorities, which are based by looking at the data from the environment we work in and that our clients are living in, idea generation, and business planning through to launch, just like many do in the for-profit sector as well. And it's that more formal look at how we develop plans and services and so forth. In reality, though, the community support sector is also one that is really resilient, nimble, and ready. And COVID showed us that. And often it was the community support sector who was able to step forward and ensure that essential services continued to be run, that clients continued to have that connection that they needed, that we didn't forget about them just because the world around us was on lockdown. So we've really demonstrated that we're able to move quickly and nimbly. And it was interesting because I recently heard someone say that our strength as a sector is to say yes, and then we'll figure it out later. And I have to say that there are times, and I credit our board of directors for being supportive when we see an opportunity, is to look at how do we do it, and then we'll figure it out later. I wanted to share a few examples of some of the cool things that this strategy has achieved for us at CHATS. And the first is the Hospital at Home initiative, which is being implemented across a growing number of hospitals as a means of decreasing alternate levels of care patients in hospital when they should be elsewhere. CHATS has become involved with, or became involved with one of the first prototypes at Southlake Regional Health Center when we were initially asked if we could provide Meals on Wheels to some of their hospital at home patients. And we were more than happy to do that. But we said, there's other services that would also benefit these patients and help them to settle back at home and avoid readmission if you let us work with you on this. So that's how we were able to demonstrate that our transportation services, providing social engagement through our adult day programs. We actually developed an adult day program at home program for those clients who are not quite ready to go back into public programs. And most importantly, caregiver support, because that's really an area where we excel. And we felt that if we could meet with and support the caregiver early in that journey from hospital back home, that would be a formula for success for the patient to be able to stay at home, as well as reducing that caregiver burden. We're now involved in 4 different hospital at home programs with 2 of the hospitals in our catchment area. The next really cool thing that we're getting involved with is NORCs. And I know you've had a couple of presentations about naturally occurring retirement communities. And these are buildings or neighborhoods that are not intentionally built as seniors communities, but have older adults representing at least 33% of the residents. Again, this is not a new concept, and programs like this have been around since the 70s. We've done quite a bit of research in this area. CHATS already provides some NORC-like services in buildings through our wellness and assisted living programs. So we decided it really made sense for us to look at ways to expand on those services that could be provided throughout our catchment where NORCs are located. As a result, we are initiating a pilot with Housing York to look at implementing the OASIS program with the support of Queen's University in 3 NORC buildings. we're also exploring the PACE model to determine where that could best work as well. And I wanted to acknowledge one of our local members of parliament, Tony Van Bynen, for his support for developing NORC programs in our catchment area. Tony actually requested that the Human Services and Standing Committee on Human Services and Skills Development and Persons with Disabilities, it's a long title, initiate a study of how NORCs can support healthy aging in Canada. So I know that we referred your organization to the standing committee, and hopefully the current change in the federal government won't impact, and we'll be able to see that study come to fruition. Another program that we're very excited about is the establishment of York Region's first nonprofit overnight respite care home for persons with dementia. We were thrilled to be invited to partner with a nonprofit organization called Care as One, who has purchased and renovated a heritage home to be used as this overnight care home for short stays. This would be anywhere from 1 to 14 nights. And really as a respite opportunity for caregivers so that they can bring their loved ones for a short stay while they go on vacation or go to a wedding or whatever needs that they may have. At this point, we're still advocating for operating funds. We've been able to raise capital funds to purchase and renovate this lovely building. This is what it will look like when it's done. Right now, it's still undergoing renovations, but we still haven't secured long-term operating funds. But again, this was something that our board said, this is such a needed service in our community, and there's a huge gap that let's do it, and we'll figure out how we'll pay for it. And I don't mean that kind of in a risk that we're risk tolerant or anything like that, but it's just an example of we will get it done. And I think that the opportunity to work with Care as One was such a great one that we couldn't pass it down. Some of our initiatives are often by serendipitous design. Last year, for example, we partnered with an organization called My MS Family, which has sort of splintered off from the MS Society when the society decided to focus more on research as opposed to program development for its membership. And I happened to be at an event that was put on to recognize different community organizations, and sat beside an individual who's one of the lead volunteers for My MS Family. And we got to talking about, what does your organization do? What does your organization do? And we discovered that there really is a dearth of programs for persons living with MS that focuses more on the social engagement as opposed to support groups. There's lots of support groups that get into sort of the issues around living with the disease and managing the disease and different pharmaceutical approaches and that sort of thing, but nothing really that supported them just to go out, be together, and have fun. And I said, well, we've got space. We've got an office that has some community space, and if there's an opportunity for you to use it, we've got staff that could be helpful. And we decided to do a pilot. And lo and behold, the pilot ended. There was such a great response to it that we've now decided that it's going to become one of our ongoing programs with My MS Family. We're going to be starting up a new program in the northern part of the region to provide greater access to people living with MS. And it's just been one of our great success stories, and really filling a need that was there in the community, and one that we're able to deliver at a relatively low cost. My MS family is holding bingo, doing bingo games to raise funds for our minimal staffing that's required, but it has been so well received and fills a really important need and gap in the community. And my final example is our newest partnership with Toronto Grace Health Centre, which has developed a remote care monitoring program that's being spread throughout the province, and mostly working through Ontario health teams throughout the province. And might I say, I think they've actually branched out across Canada. And using technology, the program enables a more integrated support to be provided to people right in the home, with trigger escalations in the event that a client is in need at a particular time, providing emergency alerts, providing an opportunity for health monitoring through the technology device. And we had an opportunity to meet with the folks at Toronto Grace and share the kinds of initiatives that we're involved in, and particularly our assisted living program, which lends itself so well to being enhanced through remote care monitoring. So I'm happy to say that as of yesterday, we have signed the Memorandum of Understanding, and we're now officially a partner with Toronto Grace on the remote care monitoring program, and will now be one of the referral agencies for RCM in the community that we serve. So, as exciting as all the cool stuff is, we continue to have pressures on our proven suite of services, and simply put, we need more equitable investment in order to continue to add value in the healthcare system. And by equitable investment, I mean, the gap between what is funded for the community support sector versus other parts of the health system is immense. It's quite significant. And yet we know, not just anecdotally, but with a growing body of evidence, that the value that we bring, particularly upstream, can save costs further downstream, can result in better outcomes for the people that we serve, is more person-centered, and can result in better outcomes, and hopefully avoiding that institutionalization, if not eliminating it. That might be putting it a little strongly. So this is something that we are really focusing our advocacy on, is trying to demonstrate not just the value we bring, but also demonstrating the need. And I started out earlier talking about our volunteers and how vital our volunteers are to being able to deliver as efficiently and cost effectively as we do. But the reality is we are facing a volunteer crisis. We had close to 500 volunteers prior to COVID, and coming out of that, we were down to below 200. We've been focusing our efforts on doing a volunteer refresh, trying to attract and recruit new volunteers. But the reality is that COVID, I think, did have a dramatic impact on, the kinds of things that people are now interested in doing, and so that's affecting us, and not just CHATS, but all of us in the not-for-profit sector, who have come to rely on our volunteer base to deliver programs. So as that crisis hits us, it just presents more demand for on our workforce. So we need to invest in our workforce. There's also a significant wage gap. I talked about the cavern between community support services funding and other parts of the health system. There's also a significant wage gap between personal support workers who work in our sector versus those working in hospital and long-term care. And you can see by the slide, 19% between those working in hospital and community, and 9% gap between those in long-term care and community. We're also having challenges as a result of that wage gap and being able to compete in the war for talent. So attracting and retaining those frontline workers has become more of a challenge. So we do need to have this addressed and that equity brought back to our system. So faced with these challenges, the CHATS board decided that we needed to become an advocate and voice for our clients and caregivers, as well as service providers. So together with the Ontario Community Support Association, one of the things that we did was develop an election-ready platform. We call ours Invest in Chats. And the idea is to be ready to reach out to candidates during elections, and most importantly on an ongoing basis, because this isn't a one-off when you're involved in advocacy. It's important that you build relationships with elected officials so they recognize who you are, what you do, but most importantly, the importance of what you do as a service provider and bring to their constituents. So it becomes more personal. And there is nothing more personal than bringing relevance to an elected official when you talk about, so how are you caring for your parents or your spouse or a child or a loved one? And what are the challenges you're experiencing? And then they get the message. So our advocacy message, we try to keep simple. And the first is that we need greater investment in home care and community supports. We're not talking just more money and more funding. We're talking about that money and funding being an investment, not only in terms of serving the clients of today, but also positioning ourselves to deal with what we know is going to be even greater demand in the future with that aging population, with people living longer with more complex care needs. We also convey that we need to close the wage gap in order for us to be able to compete in this war for talent, in order to build a strong workforce. It's been estimated that if demand continues to grow as anticipated, that we will need at least 4 times as many personal support workers just to serve the clients that we have now, let alone for new clients coming on stream. We are making some progress. This slide shows some of the metrics that we tracked in the recent provincial election. And the one that I would point out in particular is how many people actually took the time to visit our website. Over 1,700 visits to the Invest in Chats. So there was interest. Something was drawing people there. Word is that April 28th is the date that we might expect the federal election to take place. So rest assured, we'll be gearing up for our next advocacy campaign focused on the federal election, and we'll be building on what we learned and what we were able to communicate during the recent provincial election. Some feedback I wanted to share. We had one candidate who came and visited our office because during the campaign, part of the process included inviting people to come and see our programs in action. And the one candidate was so impressed that and he's an epidemiologist, that he offered to support Chats with our data needs for program planning and service delivery. And we will be taking him up on his offer. I'm pointing this out because one of the things that as a sector we have often heard from public policy makers and elected officials is that intuitively we know that you're doing great stuff and that the results are wonderful and people really appreciate having access to your services, but we just don't have the data. And of course, we're always surprised to hear that because we fill in reports and we're submitting data of all kinds. So this is something that as a sector, we are now working collectively on addressing. If it's data you need, let's find out what kind of data you need, and then we'll get it to you, because that should be an opportunity for us to demonstrate in an evidence-based way the value that we bring and why it's so important to have that investment in what we do. So we need to work together to get the message out and the results to follow. And I have noted that SSAO has now kind of switched a little bit of direction towards more of an advocacy role and meeting with elected officials. So the question to us is always, how bold do we want to be? And I recently received an invitation from Rotman to do a screening of a new documentary called The Day Iceland Stood Still. I hadn't heard of this initiative and just got the invite to the screening. But it's essentially the story of a mass movement by women in the country to demonstrate what would happen if they took a day off and weren't there to support the country. So I just wanted to play this trailer for you. Saskia?
Almost all the women in Iceland are on strike today. It's National Women's Day there, and the women are refusing to work in even their own homes.
If women don't work, everything collapses.
We are going to show them that we can stop this society.
The man thought it was ridiculous. Oh, you are so silly.
Goodbye.
The beds were not made, dishes not washed, the telephone system went dead, theaters did not open, most of the schools were closed.
Well, it didn't come to blows, but we got very harsh words, mostly from men.
They were thought to be destroying the role of the housewife and putting society on its head. It's like a revolution, you know. I saw the flags coming up. And it was beautiful.
The men, they called it the Long Friday.
So while it's not likely or safe, certainly for all of us in the seniors care sector and informal caregivers to just stop providing care to make a point, we do need to impress upon our decision makers and elected officials the consequences of what would happen if we weren't here. So with that, I want to thank you for your attention. I hope I've been able to inform and inspire those of you. We're looking for volunteers if anybody is so inclined. And I started out with the slide of the baby and thinking of the baby in 142 years. Just want to leave you with this picture of, you know, someone who's not that far off and will probably still be jumping around on the stage when he's over 100 years old. So thank you so much for your time. We will make the slide deck available to everybody. We've got the contact information, and I also invite you to listen into our podcast where we talk about aging in the community. And we've had some great guests on to this point and look forward to a number of other guests coming on. So I thank you so much for the invitation to be here, to speak to you, and look forward to some conversation and discussion. Any questions?
Christina, thank you so much. And you know, there's a bunch of things that you said that were so important. You know, it's not enough for all of us to sit back and let the people in the not-for-profit sector carry the load. We really do need to get out there and talk to our elected officials at the local level. You know, I mean, you made reference to that SSAO has changed direction. We have. We've given up trying to convince cabinet ministers who just don't want to hear about it. What we're doing is we're encouraging our members now to go out and brief their MPPs, and we are having a session on that in the near future. Like I think early next week, I'm going to be doing a session on that because some of us have briefed MPPs for a very long time, and we do know how to influence them. And so organizations like yours, Peel Senior Link, Community Care Durham, a lot of others that are in the not-for-profit sector, they deserve to have people supporting them because you know what? It's not okay that you should be so inequitably funded. If this government had 6.4 billion to push towards for-profit nursing homes that nobody wants to go to, where are the billions for the not-for-profit sector where people do want to go to? I think that's what we've been trying to say, and so that's why we're trying to move it in that direction. So that's all I'm going to say for now. I'll have more later, of course, because I always do. Um, but if people want to put their hands up, if you go down to your React, you should have a little heart at the bottom of your screen that says React, and if you click on it, it says raise hand. So if you would like to say something or ask a question, you can go ahead and raise your hand and I'll take people in order. I see Cecily already has her hand up. Cecily, go ahead.
Hello, wonderful presentation. On the subject of volunteers, where I volunteer, there is one other lady that volunteers also, and she works for a company that I guess at the management level that don't pay overtime to their management employees. But what they do is those employees can take 3 or 4 hour morning or an afternoon, a week, whatever, and use the overtime they've put in to volunteer within their community. I'm wondering if, especially York Region, you have a lot of large businesses there. Whether anybody else has heard of this, it's one thing this one company does on its own, or if it's something that maybe more companies would be interested in supporting.
You're not muted, Christina, I don't think.
Okay. Always looking for that button. I haven't heard about that program. I know that there are a number of organizations, companies that give time off for volunteer activity, but I haven't heard with this sort of this trade in time. With the ones that we do get some volunteers who are given time off, it's more sort of episodic volunteering that they're interested in doing. So, come in and fix up a garden or, participate in a program, but not on a sustained basis.
Yeah.
So we value that participation as well, but we really are looking for volunteers who are willing to drive, deliver Meals on Wheels, do telephone reassurance, friendly visiting, help out in some of the programs. But I'd love to learn more about.
Yeah, her particular company, like she does 3 hours every Wednesday morning.
That would be great.
So and I'm just wondering if, I had never heard of it before, but I was just thinking, like with other major corporations, maybe something that could be looked at, that's all.
Yeah, and we, as I mentioned, we undertook a major volunteer refresh initiative. So that's something I'll suggest to our volunteer coordinator, that maybe we can approach some of the local organizations in York Region and see if we could get even one or two to start.
Yeah, I thought it was phenomenal that she can do every Wednesday morning 3 hours.
Yeah. Yeah, absolutely. And, you know, we need to get young people involved too, right, Christina? You know, and get them more interested in the aging sector because those kinds of connections can be terrific.
Yes.
I'm just wondering also about community college students and doing their placements.
Mm-hmm.
Agency, I'm sure you have some already, but sometimes they decide to stay because they like it so much. Because I've supervised students in those settings and they've ended up staying or getting on the board of directors or working for the agency. So,
Yeah.
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 So,
Yeah.
Carolyn and Jerry have their hands up, as does Francis. Nope, somebody else does. I'll have a look. Carolyn, you're next, and then Jerry.
Thank you. Thank you, Trish. What an amazing accomplishment, Christina. And you started, were you involved in the original 8081 inception of this organization?
No.
Well, you've inherited an amazing group. We're a small group in Ottawa, the Seniors Health Innovations Hub, and we've been trying to implement innovations, but not ourselves. So the point being that we try and get people in the community to help us think of good ways of providing services, not the traditional manner. For example, our main one right now is promoting the use of nurse practitioners allied with community health centers and Pearly Health to provide primary care just to seniors in small neighborhood-based clinic and so on. And we've got some traction, we're hopeful. But now we're looking around and recognize the next frontier is caregiver support and help and home care and community supports. And we're working with a couple of those providers, not-for-profit providers in the community. But what, in your experience, do you think you would direct a group of fairly motivated volunteers that we've got on a list to help alleviate tensions and or tight spots in terms of home care or caregiver support? Do you have any recommendations for us? I guess I'm asking.
Yeah, I mean, it just even some small things like offering to shovel walkways. You know, we had the significant snowstorm last month, and I had a number of people contact me for help clearing windrows that were left by the plows for, you know, people whose elderly parent was at home alone and couldn't get in and out, and you know they didn't live in town, so you know just things like that can help a caregiver, or you know offering a ride, or you know really trying to see what kinds of things can kind of alleviate the stress of having to think about you know so many things.
Yeah. Okay, good. Thank you. I mean, we'll work with the community, and they have certainly the providers themselves have a need for the volunteers that we have, and we're encouraging them to go. I just didn't know if there was a specific, for example, teaming up with some of the programs that are the primary care outreach programs that are looking at frail seniors and providing support there that's normally government funded but hasn't been, you know, because it's hospital based. And but anyway, we'll continue to just help around the edges. But
yeah. So I think contacting your Ontario Health team is also a good place to see where there's a need and where there would be kind of a natural fit between the volunteer kinds of activities or supporting activities that are being undertaken through the health teams with primary care.
Yes, thank you, Christina. Actually, we're meeting on Monday with our Ottawa health team. By chance, we have on Monday.
That's great, Carolyn. And Casey Callahan, take a look at his comment in the chat, because he's saying that in the 80s, he wanted to work on innovative policy to move the system away from the dominant medical model. And he's saying that you guys should talk. So have a look and see.
Okay, I will. I will.
Maybe you can exchange an email.
Okay,
I think Jerry is next. Jerry?
Yes, I must say that was a wonderful presentation. It sort of really gets people fired up. Um, and I think both of you, in a way, have responded to one of my many questions, but I'll only pose one, and it's this whole thing about involving young people. And I noticed in the gallery when I first logged on, there was a young man signed on from Queen's University. And that would be really interesting to know what he's interested in. But, I've been amazed when I have a girlfriend who has three grandsons. The youngest one now is at university. The older two have gone through university, but the middle one is going back to do his master's, and he's very interested in being involved with seniors in any future job. And I have wonderful conversations with him. And because he's got his grandma and folks like me around him, he kind of gets it that we don't all want to be in organized, long-term care. And we have wonderful conversations, and I think they're full of good ideas. And I'm wondering, even like high school kids could come and help because they have to get community hours, don't they? And interestingly enough, to your point, Christina, that tends to be a sort of more, it's hard to get those folks to be continuous, but I belong to grandmothers, which is nothing to do with aging. It's all to do with raising funds for the Stephen Lewis Foundation. But when we've got fundraisers, I have had high school kids help us, and they kind of enjoy it, and it gives them a bit of an insight into organizations like yours, chats, or with SSAO that they know nothing about, but they tend to be more interested than we think. And I think that trying to go after young people, I know in grandmothers to grandmothers, we struggle even to attract 40 and 50-year-olds because they're still working and they have grown kids and they're looking after their own parents. But, we're all rolling into our 70s and 80s, and we're going to need people to help us for sure.
That's very true, Carolyn. And I think the ideas are good. I mean, I'm sure Christina and her staff are out there already beating the bushes with
Yeah, I'm
high
sure
school
they are.
students. And the Queen's University people are already involved with chats, as Christina mentioned, working on the NORCs, which is wonderful. And of course, they have MSW students and they have other students working there that I'm sure you've already met, Christina. So
My building has done work on a NORC, but I think we're going to run into problems because it's mainly owned. It's not a rental building.
yeah,
And so
Jerry,
you have different challenges.
Jerry, email us at seniorsactionontario@gmail.com and let us know where you are because UHN, University Health Network, NORC Innovation Hub, and Queens are reaching out to people in seniors buildings to assist. So we might be able to hook something up there.
Okay, great. Thank you.
Okay, I have two more people with hands up, Francis and then Sheila. So Francis first.
Hi. So again, just to reiterate, great presentation, Christina,
Thank you.
and pleasure that we get to work with you. I wondered, as we're talking about volunteers, it's really an issue that's hard for not-for-profits, if I'm not mistaken, because of, is there now not insurance and liability that's involved where if you want to volunteer, if you're a Meals on Wheels driver, that you have to carry a certain amount of insurance and you have to have, at least this is what I've heard of late. And so it can also limit the ability of people to participate sometimes that are very much interested to be volunteers, but have to jump that hurdle. I don't know if you've heard of this or others, but it's something that could be a barrier that I don't know. It wasn't in the past.
Yeah, I haven't heard that that there's anything new that applies to Meals on Wheels drivers. I know that that there is no requirement for additional insurance if you are driving people, because it's like, you know, you're driving your neighbor or a friend or something, and you're not getting paid to do so. So there's no, your regular insurance coverage covers that activity, and I'm pretty sure that's the same with Meals on Wheels. Certainly that would be devastating to us, to lose our Meals on Wheels volunteers. So I haven't heard that that's an impediment.
Okay, something I can
I
explore
will look,
as well,
well,
but just,
I will look into it for sure, but
Yeah, the last thing we need is that.
one more barrier.
Yeah. Sheila, you're next with a question.
Thank you. My name is Sheila Tottenham. I'm also in Ottawa. I wear a number of hats, some of which overlap at times. I am a full-time caregiver for my husband, and have been doing that since 2017. I also have done some work with Carolyn Inch and her group. Hi, Carolyn, nice to see you. And I'm also a director on the board of directors for the Ottawa branch of the National Association of Federal Retirees. So you've mentioned a couple of things, Christina, which I would love to touch on. I don't think we have a whole lot of time to do all of that. But one thing I wanted to mention in terms of the federal retirees is that in terms of the Ottawa branch, we have gone out and met with elected officials, both at the provincial level, and we will do so, or we will continue to do so at the federal level with, as you say, the election coming up. And I wasn't sure if you have some kind of a script that you use when you're talking to federal officials about healthcare, since it's basically a provincial jurisdiction. So that was my first thing I wanted to mention, whether there's something that you have that you would be able to share, so that if we could go out and talk about home and community support for our seniors at election time, then that would be very helpful. The other thing that I wanted to mention that is on behalf of the Ottawa branch of the Federal Retirees, we offer a program called Neighbors Helping Neighbors. This was a program that was developed by the Victorian Order of Nurses back in the early 2000s, and I think primarily in Southern Ontario. And it basically is to give a primary caregiver a temporary break by being able to ask a family member, friend, or neighbor to come in and sit with their loved one while the primary caregiver gets some time off. I've been offering those workshops. We did receive instruction many years ago from VON representatives here in Ottawa. And so I've been giving that workshop since 2015, and I'm still doing it after all these years, 10 years, I can't believe it. But I'm wondering if other people in Ontario are aware of this program. It's not to be a volunteer per se. We're not teaching people. We're not looking to match volunteers with the needs. But if we can educate primary caregivers, members of their families, their friends, to provide a break, then that helps to maybe not eliminate, but at least to reduce the caregiver burnout that is just so prevalent among primary caregivers. And that's all I wanted to mention.
thank you, and thank you for the work that you're doing.
Yeah. Yeah, it's a huge, huge issue. I just as I'm waiting for more people to put their hands up if they have a question, your small home initiative around respite care is of tremendous interest to us right now. The reason being, it's extremely timely. I understand that Ontario Health is working on small home initiatives, and that SSAO has put together a working group. David McCauley is here. I know he's on the working group. It would be wonderful, I think. David, you may have some interest in hooking up with Christina and possibly taking a look at that, because that's exactly the kind of permanent, not just respite, small home initiative we would love to see developing in Ontario, because we have nothing. People with developmental disabilities have a whole system of small homes, but older people have nothing. And it's really time that we got going on that. So that's one of the comments I wanted to make. And the other thing is, I don't know whether you use the MAPLE assessment. I know it's used in hospitals and elsewhere, and care coordinators, I think, in Ontario Health at Home use it. But I think there's been a shift in the civil service looking at not just using the MAPLE assessment to determine people's deficits, to find out who should be eligible for long-term care. I think they're trying to shift that and look at it to see what kinds of services and supports does MAPLE identify that should be in place in the community to keep people out of institutions. So that might be another interesting argument to say, can we reverse MAPLE and just look at it this way, that these are so-called deficits that you're identifying that put people at risk of long-term care. Could we maybe say that those are the very things you should be funding us to provide so that they don't end up there? Because I think there is some interest at the senior civil service level in actually looking at that. So it might be just another way of arguing your case.
Yeah, no, that's a good point. And the challenge has always been that the focus is so heavily on hospital and keeping people out of hospital, addressing the surge and so forth, that looking upstream is always like, okay, yeah, well, we'll get to it, but
exactly.
I think until we get that equity lens on, and not just in a DEI way, but equity between the sectors, then it's something that we just need to continue to advocate.
It's true, because people are following the money into long-term care. I mean, that's where the funding is, and that's not where they want to go, which is why we're trying very much to turn that around and say, wait a minute, why don't you send the money the other way? Because if you do, then maybe you'll find people will be staying at home and in their communities. I just want to draw your attention, if you haven't seen the chat, but from Kenora, they were talking about having had a volunteer fair up there that drew a lot of people, and there seemed to be a lot of interest. And the other comment was from HP Morella about a home sharing program that they have sort of, they're looking for organizations, bigger organizations to partner with. And I interestingly, Morella, you're going to be interested to know we will be talking about a home sharing program. That's one of our next sessions, where women living together is going to be one of the programs. And I think they may even be up in your area, Christina. So partnering might not be a bad idea there as well. And there may be some volunteers there. We will talk with Pat Dunn about it and just see, but there might be some good volunteers there as well. So
prior to COVID, because of course now we measure everything as before COVID and after COVID. We had been in discussions with York University and an organization called Raise the Roof, which is addressing the challenge of housing. Because York University had opened a new campus in Markham, but they didn't build any residential facilities for the students. And so we knew that there was going to be a challenge for students, A, to find housing, but B, to find housing that wouldn't put them in an isolated position, and a lot of the students at that campus happen to be international students. So we were looking to see if we could start some kind of home sharing program for those seniors who live alone, so that they could have a student come and live with them in exchange for maybe, you know, helping with lawn care and snow removal and, you know, light duties around the house kind of thing. And so that would address the housing issue. It would address the isolation issue. And we thought that would be a great intergenerational initiative. But unfortunately, we just never quite got it off the ground. But I believe there is a home share organization in Toronto that's built on a model that had been developed in the UK, because we were looking at that and talking to them at the time.
Yeah.
But I still think it has merit for exploring, particularly since housing is such a challenge for many people.
Yeah, it is. And, you know, you don't need more on your plate right now because you've got quite enough. But, you know, it is something where if there was to be a home share program started in York Region, and I think I'm going to check with Pat and just see where they're located, and Canada Home Share as well, it would be a really good idea. And then at least you could let older people living alone know about it, which would be helpful, I think, and not too onerous for you and your staff to have to try to manage, because trying to start a home share program is not easy either. So.
Yeah, and Francis, I don't know if you're still on the line, but I'm not sure if the region has looked at this or is considering something similar.
Certainly, we're looking at lots of different options through the plan to support seniors, but I can't say that we've actually entertained that as of yet. Oh, I don't think I'm on screen. Sorry.
Oh,
there we go.
Okay, I think there you are. Okay, I think, Jerry, I think you had your hand up, and then Keith.
It was more really just as a comment. I'd be interested to know, because you girls are just advocating like crazy, but in the provincial election, I didn't have anything come through my door from any of the parties that had anything to do with seniors listed on it. And I've emailed my city councillor a few times and just said, where are we with the PACE program? And I've never had a response. And she's very, you know, outgoing and busy, and she puts information out to us every week. But it was kind of disappointing that at the provincial level, I didn't see much help going on during the recent election for anything to do with seniors.
And if I can jump in there, Jerry, if you join our MPP's briefing workshop, we will tell you why that was.
Okay, I just looked at that today, and okay. It's the same evening as I have my monthly grandmothers to grandmothers meeting.
Then email us and we'll be happy to fill you in.
Okay.
Okay, I think Keith had his hand up. Keith?
Yeah, I'm not muted, am I? I'm good?
No, you're good.
A couple of things. I also sit on the Ajax Homelessness Task Force. The count in time, there's more seniors homeless right now than ever before. That PACE and everything else would fit so nicely with, in terms of the most vulnerable seniors that are out there. Joanne's Place, which is our youth center, they have started vetting kids to go to homes instead of into Joanne's Place itself. And my own opinion is that a lot of homes, literally houses, are underpeopled.
Yeah.
Like I have an 84-year-old brother who lives in Ancaster in a bungalow by himself. Mm-hmm. You know, at least 3 spare bedrooms. So he's been taking in McMaster students every once in a while. I also got him out volunteering, doing Meals on Wheels and transportation. So he's no longer lonely, because loneliness will kill more people than anything. So I think there's some like just the fact that houses are under peopled. We've got so many spare bedrooms, and trying to find a way of getting people not just to huddle together, but someone who's a homeowner now, and to be able to take someone in who's on the street or vulnerable, and then you end up with little pods that you can service better with PSWs coming in. It's fascinating listening to the journey you've been on. A long time ago in a land far away. Well, yeah, I was in developmental services and helped to shut down the big institutions and get in people back home into group homes or back home with proper services and things like that. So a lot of it's repetitive, and services for deaf blind people that were unthought of before, and their horseback riding and cooking for themselves and on and on and on. So everything's possible.
Yeah.
All of the wartime houses that were built, and Ajax has a lot of them because of the DIL, the munitions plant that went in here, were built for about $750 each, and it took 2 weeks to put them up, to erect them, because they're all, they were just, and they're still standing and they're still being used. We can do micro homes, small homes in a flash if we were just given the venue, and people who are homeless or seniors would so thrive in their own little unit like that, and they can come out and go to services, or services can come into them.
Yeah.
So I mean, the micro home thing I see as a real boon, and lots of, I'm trying to tie the two of homelessness and seniors together, but I know that a lot of people on the street are on the autistic spectrum disorder, on the spectrum, and then those who have ADHD, and tied in with that are into drugs, street drugs, to calm things down or to speed things up. And they don't do well in facilities at all. And as much as we have shelters and whatnot, they don't do well in those. They will do extraordinarily well in a micro home or a small home.
Yeah, and to bring it back to Christina's services, it's so many people would not end up unhoused if we had more, in-home and community-based support services like Christina's.
Yeah.
Sadly, they're not being funded. And that's right. That's where Keith, that because you're on the Durham Action Committee with me.
Yeah.
That's where we all come in. We have to start really advocating at the local level to support organizations like Christina's.
I also want to say that out of the blue, at our meeting yesterday afternoon, our newly elected Liberal member of Parliament dropped in on the meeting and stayed for the whole meeting.
Yeah.
And it was just awesome. And it was there in high interest to find out what was going on in terms of homelessness and whatnot.
Yeah.
And so we'll not need any poking to get him to senior socials.
No, and he's been briefed on elder issues also. I just want to say to the group, one of the things that we did in Ajax, where I also live, is that we flipped a riding from a PC riding to a Liberal riding, one of the only two in the province that did that. It was seniors who did that.
Yeah.
Cecily White, where are you, climbing over snowdrifts? My husband and I climbing over snowdrifts and going out talking to people and handing out material where they hadn't heard from any other party. That's what flipped the riding. It flipped by 300 votes. So that's what matters, and now the new MPP is very keen to hear about the issues that we're concerned about because we helped him. He's prepared now to help us, and he's very interested. So, don't discount that, especially in the federal election. And I know, Christina, your organization has a wonderful relationship with Tony Van Bynen. And, having a federal MP be pushing for NORCs federally, that's a really good thing. So these things all matter. And sitting back and not being politically active has been costing us. And I think we need to really change that at the local level. So Carolyn, you had your hand up.
We were briefly on the topic of housing, and I recognize that's not really Well, Christina, you do have senior supportive housing. You've got long-term care in your portfolio, right?
No, we provide assisted living
Okay, yeah.
services, but we don't own the buildings. We're just we're co-located in the buildings. So our staff are there. They have an office, and they serve the clients in that building, but we don't run the supportive housing or.
Actually, Christina, that's also what I wanted to mention is the programs like PACE and Hub and Spoke and the programs Christina are delivering are helping prevent homelessness, frankly,
Right.
you know, and helping prevent institutionalization. So that's why they're so important.
Yeah. Well, we're trying in Ottawa again. This is part of our Seniors Health Innovations Hub. We're aware that Confederation Heights, which is a big bundle of vacant federal land, has been for 15 years. But of course, the pandemic has got a lot more vacant federal land across the province now, and they are turning. At first they were looking to see what profit they could make from it, but apparently they've been given instruction lately, the Canada Lands Court, to look at what not-for-profits could do, or keep it in the community in terms of ownership. So we're looking to try and get a long-term lease on some buildings and to have an intergenerational senior village near Carleton Universities, because student housing is really what collapsed the whole international housing, international student thing, which is collapsing universities now. I mean, housing was a big part of that. And so if we can provide student housing and seniors housing, that would be a variety of, say, supportive in some ways, like Abbey Field houses and so on and so forth, as well as right through to long-term care. We're partnering with Pearly Health and looking at probably about 100, when I say village, there'd be maybe 100 residents of varying ages with cafeterias, and it's right beside the
sorry, Caroline, I'm interrupting because I want to just bring it back to
okay, but the point is we would have
topic at hand.
Supportive services.
We would have unenviable job as moderator to do that.
Okay, Trish, I understand. I was doing a pitch for volunteers being in that service too as well.
Yes, absolutely. Christina, I don't see other hands up, so I'm going to just wind things up, but I just want to thank you for an incredibly thorough and comprehensive presentation, and I want to thank you personally for caring so much, because I know you do, and you have done this for so long, and you are one of the leaders in the not-for-profit sector, which is why we so much wanted to hear from you. I know that a lot of people after these presentations will go and watch the video, which is really great, which is why I'm glad we have done the video. But you've done such a great job, you and your staff, who've worked incredibly hard, and you've been really innovative, which is a wonderful thing to see in the not-for-profit sector. And so I'm so happy for your leadership, and I want to just thank you for a wonderful presentation today.
Well, thank you, and thank you for what you do and all of your members do as well to, help advance the issues and the services.
Yeah. Abby, you're going to get the last word, but it has to be quick. Go ahead. You're muted. I don't know if he's going to say anything. Okay, well, then in that case, I'm going to wish everybody a wonderful afternoon. The sun is shining here anyway. And I hope you all have a wonderful spring and summer. And Christina, thank you again. And thanks also to your staff. And I know you've had a staff person here. Is it Siska, who has been helping out with the IT?
Thank you.
So thank you to you as well. Okay, so good afternoon, everybody, and enjoy the rest of the day.